All right, so I've entered into my room. I'm going to, just for video purposes, this is a soda bottle I'm going to use for the Foley catheter insertion, just to display it here. But I'm going to enter into the room. I'm going to announce that my name is Michael. I'm going to be your nurse today. And can I get your name and your date of birth, please? I'm going to verify on the wristband of the patient that the identification is correct. And then I'm just going to look at my orders right here. And it looks like we have orders to insert a Foley catheter. And do you know what a Foley catheter is? Let's assume the patient doesn't know what a Foley catheter is. I'm just going to explain to the patient that they have urinary retention. Plainly, that means that you are retaining urine in your bladder, and we need to get that urine out. So we're going to insert this tube into your urethra. It's going to be a little uncomfortable, and you're going to feel a little bit of pressure, but it'll be over before you know it. So we're going to go ahead and get started. I'm going to wash my hands. I'm going to put on gloves. And we're just going to go ahead and expose you. So I'll take back the sheets and the blankets, and I'll put her legs in. If it is a female, I'll put their legs in almost a lithotomy position or a butterfly position, just to expose the labia and the vagina. And so we'll go ahead and I'll also ask, are you allergic to latex, eggshells, or iodine? And if they're not, then we can go ahead and proceed. There's other things that we would need to do if she is allergic. So I'm going to go ahead and so I got a size that fit my hand gloves for sterile gloves, and I'm going to go ahead and empty everything out here. And normally, to maintain my sterile field, obviously I don't have the ability to be able to have this waist high, but we would want this waist high so we can maintain the sterile field. But just for video purposes, we're going to do this. All right, so I'm going to open up away from me, and I can only touch the 1-inch border all the way around, so we can maintain our sterile field. All right, and I'm going to drop these gloves off to the side here, and I'm just going to go ahead and place the sheet down under the patient. Obviously, in a real setting, I would have to not break my sterile field. I would go around the patient and tuck it underneath their bottom a little bit. Have them maybe lift their bottom up a little bit just to have that area secure. So we got that. This is also for a male. If we had a male, it would go around the shaft, but we don't need that. And then I'm going to go ahead and position my sterile field like that. And I'm going to go ahead and open these gloves. All right, I'm going to glove my dominant hand first. So I'm going to pick up the first glove without touching the inside. I'm going to go ahead and down like that. And then I want to get underneath the cuff on the right-handed glove. And like so. And we are now sterile. And then I'm going to go ahead and take this box, and I'm just going to position it like so. All right. I've got my lube. I've got my swab sticks. I'm going to set this bottle off to the side. And swab stick. And I've got my saline. So I'm going to take the lid off of that. And I'm just going to set that off to the side. All right. I'm going to go ahead and put my lube in the corner of this box. And I'm going to go ahead and take the catheter. I'm just going to kind of roll it up so I don't go outside of my sterile field. All right. I'm just going to dump that off to the side. All right, and I'm going to just place this back in the box like so. Or actually, one step I forgot that will be difficult, and you would need a friend. And you probably would need to yell for help if you forgot this part, but I want to actually connect the syringe of saline to the catheter, so that way I don't have to use one hand to insert that catheter or insert the syringe. And then we're gonna place this back together, and I am going to go ahead and come over here, staying in front of the sterile field. I'm actually going to drop this box right in the middle of the legs, probably towards the back, just so I have room to work. All right, and we've already did the lube, so we'll go ahead and throw that off to the side. And I'm going to go ahead and just drop that off to the side. I'm going to take my swab, alcohol swabs is what we use, but usually it's iodine. All right, and we're going to drop that off to the side. And so, and actually that will usually be in the plastic part for purposes. I'm going to hold the labia open with my non-dominant hand. And if I was right-handed, I would be on the other side of the bed or these tables for this video. And I'm going to open the labia as best as I can, locate the urethra, and then I'm going to go ahead and wipe down on the outside labia, the inside labia, and then the middle labia. And I'm going to discard as so. Normally, I would not have all three in my hand, but that is a mistake. I just noticed I did. Now I'm going to, I've got the labia open. I'm going to lubricate my Foley, and I'm just going to go ahead and insert. Like so. Okay. There. There we go. All right, I'm gonna go in till I see urine. I'm gonna go ahead and inflate my balloon. I'm gonna go ahead and discard that. I've got my catheter in. I'm gonna go in for a female. I'm gonna go in 2 inches. So I went in 2 inches further. For a male, I would go in 4 inches because they have a longer urethra. And sometimes I would use a Coude catheter to go around the prostate gland. And being that women have a shorter urethra, they are prone for urinary tract infections a little bit more frequently. So I'm going to go ahead and just drop this off to the side. You would never connect it to the side rail. There's actually hooks on the bed that you actually are used for catheters. So I will go ahead and before I start messing with the patient again, I'm going to take my sterile gloves off. I'm going to go ahead and clean up the perineal area with another pair of gloves. And then I'm going to cover the patient one more time. And then obviously we'll get another order. So I'm going to come back into the room, leave. The patient is taken care of. She's got her Foley catheter. She's fine. And so now I'm going to exit the room. I'm going to come back in. Depending on the hospital and the orders, it could be a day to 3 days later, whenever the order will come in. But I'm going to look. I'm going to introduce myself again. My name is Mike. I'm going to be your nurse, and verify their identity. And then I'm also going to verify the orders. We have orders to take your catheter out today. Is that okay with you? Of course, it's probably going to be okay with them to get that out of them. So I've got gloves on. And so the first thing I'm going to do is I'm going to drain the Foley bag, and I'm going to record the output. So we'll just say for video's sake, we've got 700 cc's of urine, and we'll go ahead and record that in the patient's chart. And then we're going to go ahead and you would get a flush. And we are going to, and also, we don't have stat locks for the video purpose, but you would put it in a stat lock to secure it to the midline thigh or even lower abdomen, just for check-off purposes. So, so we're going to uncover the patient, expose them again, put them in. If it's a woman, you're going to put them in almost a lithotomy position without the stirrups. And then we're going to go ahead and deflate the balloon. All right. And this should come out like so. All right. So the patient is now relieved of the Foley catheter. We would go ahead and clean the perineal area, make sure everything's clean and nice and tidy. And then we would pull up the sheets and the blankets again. And that concludes a Foley catheter insertion. All right.